What specific view?
Equilateral.
Okay, and this is the lateral view. So let's review the anatomy. This is the frontal bone, parietal bone, occipital, temporal. So what is this suture? Lambdoid. And the yun ano dito? Lambda. And this one? Sagittal, coronal. Ano yung ano dito?
Bregma.
Okay. So this is Caldwell. So ang clue nyo na lang, 15 to 20 degrees. Tapos ang fino-focus niya ay yung frontal part. So this is, ano to? Frontal sinus. This, ito. Orbit. How about this one? Maxillary sinus. Hindi dito. Yung puti pag yung itim, ethmoid. Pag tinatanong yung bone, nasal bone. Ito. Ayan. And then for the Townes view, so dito sa occipital area ang focus niya. Hindi lalabas to. So waters, ayan din. So focus on the maxilla, the nasal bone, the orbit,
Competitive.
and segmento vertical view. So ito yung ano to? The zygomatic arch, right or left?
Right.
Right. Okay. Next, ito, may lalabas dito. So this is CT scan. You identify kung axial coronal, what view ha? Ito. Anong view ito? Sagittal. Kung lateral, sagittal. And then this one? Coronal. Axial. Sa tatandaan ninyo, dito yung right side part ha? And then ito, anterior part, posterior part. Anterior part, posterior, right, left. Pwede ipa-identify sa inyo dito if it's alin dito yung brain window or bone window. So this is brain and then bone. What view? So this is the CT scan 3D of the skull. So tulad din ng dati, review nyo na lang yung iba't ibang parts. Yung frontal, yung kanina yung tinanong ko sa inyo, ha? Okay, MRI. Madi-distinguish ninyo kung MRI or CT. So pag pinakita ito, alam nyong MRI. Okay. So, which one ay T1? So alam nyo na rin kung paano madi-differentiate if it's T1 or T2?
No.
So, yung pneumonia na World War II, so white water sa T2. This is flare. Pag tinanong anong diagnostic modality?
Ultrasound.
Ultrasound. So, mukha siyang brain. May mga sulci. Ano ito? What specific ventricle? Lateral. So, ito din, lateral ventricle. Sagittal view, transverse view. CT angiogram. DMR angiogram. So, ito, aralin nyo na lang. Pwedeng lumabas. So, for the scalp injury, so, hindi yan lalabas sa practicals. Pero sa exam, lalabas siya. So, there are 3 types of skull fractures. The linear, depressed, and diastatic. So, pag nakita kayo, alam niyo na yung mga normal suture, di ba? So, if it's hindi mukhang normal, like this one, like that is linear fracture. Another linear fracture kasi, diba, linya? Ito, linear fracture. This is the normal coronal suture, sagittal. Wala tayong normal suture line dito. So, this is one example of linear skull fracture. This one, depressed fracture. Yan, depressed fracture. Ayan, another example. Hindi yan lalabas. Pero aralin niya na lang, ha? So, ito, yan yung difference, ha, ng brain and bone window. Tandaan ninyo, ha? So, another example of depressed fracture with overlying lid. Diastatic fracture, pag may widening of the suture line, so the sagittal suture is widened. So this is an example of diastatic skull fracture. Another example. Okay, let's differentiate epidural from subdural hematoma. So epidural, imaging modality first. Ano to? CT scan. So epidural, syempre puti kasi bleed sa CT. Usually lenticular or biconvex siya. It does not extend beyond any suture line. Yun yung differentiating factors ng epidural versus subdural. As to subdural naman, crescentic, pareho naman silang high attenuation, ibig sabihin puti. It does not cross the falx cerebri or tentorium. So ito yung falx cerebri natin, so hanggang dito lang siya. Usually nasa isang side lang, but can cross the sutural margins. So yun yung mga differences nila, ha? Lumalabas ninyo. So, chronic subdural hematoma in CT, para na din siyang same attenuation with the CSF. Ito naman ay example of rebleeding subdural hematoma. So, meron tayong hematocrit level, ilalabas yan. So, is this epidural or subdural hematoma? Epidural. So, how about this one? Subdural. Ayan na, pwede na. So, they are both acute kasi kulay puti. Next, subarachnoid. So, these are high attenuating structures within the cisterns and sulci. Yan. So, yan, example. Ang subarachnoid hemorrhage. Ano ba ito finals mo? Yes. So, another example, so diffuse axonal injury. So, yan, sa may mga parang dad-dad. Hindi yan lalabas. Siguro dalawang questions lang sa head. Yan.
Epidural at subdural.
Mas dalawa lang. Okay, kaya mamaya sa pulmo tayo. So, this is the normal nasal bone. Ito yung example of nasal fracture. Obviously, makikita nyo naman, ha? So, this is normal or abnormal? Sige, dito tayo. This is abnormal. So, you can see on the right maxillary sinus, there is air fluid level, and there is fracture in the right infraorbital. This is X-ray, ha? Specifically, what view? Alam nyo? Waters. Diba? Pag nagpo-focus siya dito. Air fluid level. Infraorbital fracture. Segmento vertex view. So ito, this is the normal zygomatic arch. So As you can see dito sa, anong laterality ulit? Right. So may fracture tayo dito. Occipitomental. Yan din. Sa may right. And then for the Lefort, alam niyo na paano i-differentiate yung Lefort 1, 2, and 3. Okay, so 1 dito lang. So 1. And then 2. Ayan. Tapos 3.